Let in then?
Yep.
Okay, good afternoon, everyone. I am Melissa Statham, Ergonomist at the Windsor Occupational Health Clinic for Ontario Workers. And just to begin today, we'd like to do our land acknowledgement. The Occupational Health Clinics for Ontario Workers recognizes that its work takes place on traditional Indigenous territories across the province. We acknowledge that there are 46 treaties and other agreements that cover the territory now called Ontario. We are thankful to be able to work and live in these territories and to the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and who continue to contribute to the strength of Ontario and to all communities across the province. Today's Mayday session is going to look at young workers, the recognized vulnerabilities to the workplace, injuries and harms, including psychosocial risk factors made worse in the pandemic. We're going to learn more about challenges faced by these frequently exposed frontline staff in their daily jobs and some solutions to reduce risk and mitigate harm from an agency, industry, and advocacy perspective. Our first presenters are Ashleigh and Zahra, mental health and addictions counselors at the Youth Wellness Hub with the CMHA Association in Windsor, Essex. They both offer therapy and run various support and treatment groups for mental health issues. Ashleigh completed her Master's of Social Work at the University of Windsor, and Zahra completed hers at Western University. Today, they're going to be speaking about youth mental health outreach support, the challenges and solutions. And yes, thank you, Ashleigh and Zahra. Take it away.
Just gonna share our PowerPoint here.
Thank you so much to everyone for having us today. Okay. All right. So again, my name is Ashleigh, and this is my colleague Zahra, and we come to you from the Youth Wellness Hub, specifically in Windsor. There are youth wellness hubs all throughout Ontario. We're going to share our experience in the youth that we're working with and some challenges that we're seeing after the pandemic. And then we're going to offer some different solutions in terms of how we can best support our youth moving forward. And one of the best ways of doing that right now is through these youth wellness hubs that are throughout Ontario. I'll have Zahra kick us off here.
Okay. Again, just like Ashleigh said, thank you so much for having us today. And we're going to start our presentation today through a compilation of some research that we actually found throughout Ontario specifically and worldwide as well. To begin, we're going to start a little bit about what youth mental health looks like. Youth and parents throughout Ontario, specifically Southwestern Ontario, have reported that it has worsened the well-being and psychological distress during the pandemic compared to reports of pre-pandemic well-being. And the elevated rates of symptoms in the study suggest as well that youth may be especially vulnerable to the acute psychology impact of the pandemic. And we're going to talk a little bit more about the specifics of that in later slides. In all of Ontario, we have just some statistics here. So there has been definitely an increase in behavioral issues, difficulties with self-regulation, and a range of unaddressed mental health challenges. Even something that was noticed is maybe like and lack of self-awareness. In 2019, we see here that 73% of youth aged 12 to 17 years old described their mental health as very good or excellent, but in 2022, this number declined 61%. Data from the Center of Addictions and Mental Health, or CAMH, surveys were found that 59% of Ontario students stated that the pandemic made them feel depressed about the future, and 39% reported that this has made their mental health feel worse. And now we're just kind of going to look across the world, what that looks like, and how most common mental health issues that were found around the world Anxiety was risen to 28%, depression 23%, loneliness 5%, stress 5%, tension 3%, anger 3%, fatigue, confusion, and worry as well 3% higher than pre-pandemic. These rising numbers confirm cases and deaths, fear of infection, lack of education, access due to school closures, disruptions of daily routines due to home confinement, social distancing, as well as family financial loss, which have all contributed toward increased anxiety, stress, and uncertainty amongst the youth. Anxiety, absence of peer contact, lack of stress regulation, domestic violence, and child maltreatment threats are a significant concern for the mental health of this population worldwide.
And then another factor that we have some statistics on is physical health post-pandemic. So Stats Canada reports that youth reported accumulating on average 2 hours less physical activity per week in the fall of 2020 compared with the fall of 2018, which definitely makes a lot of sense. We're seeing a lot of youth that are coming into our services that, were really active in sports, active in dance, doing a lot of different physical activities, and all that came to a halt during the pandemic. And we're finding that it's also harder for them to kind of jump back into some of those activities as well. So the percentage of youth meeting the Canadian physical activity 1 hour, the recommendation of physical activity every day, dropped 50.8% in the fall of 2018 to 37.2% fall of 2020. And again, that kind of goes along with the fear, right? We were told to very much like take care of ourselves, stay home. So we weren't really getting that physical activity that we may have needed to support our mental health as well. So physical activity decreased more among youth living in urban compared to rural. Just kind of some stats there, just to give an idea of that difference. So physical activity, as we know, is a potential determinant of mental health. Regular physical activity among children and youth is related to improvements, physical fitness, academic achievement, aspects of mental health, including self-esteem. And we know that getting our physical activity is a huge support in combating depressive symptoms as well. So just kind of taking that away from our youth during COVID, definitely. So 40% of Canadian youth aged 15 to 24 reported having excellent or very good mental health in late March and early April, compared with 62% in 2018. And that's going to be one of the largest drops of any age group. The Canadian Centre on Substance Use and Addictions found that in October 2020, youth aged 16 to 24 were most likely to report mental health and substance use concerns. Something I always like to reflect on is during COVID, as an adult experiencing COVID, maybe we had plans change, we had things get canceled, but they got moved to a later time. Maybe we couldn't see family, maybe a vacation got postponed, but we got to do it later. But a lot of the milestones that youth are missing out on, there's not going to really be another opportunity to do some of those pieces. We saw youth miss the, proms, graduations, their entire high school experience, and that really has taken a toll on how we feel, right? Because we're not able to kind of go back and have some of those experiences again. So just kind of like a different and a reflection point when we look at the difference between how you've experienced COVID and how, maybe we're experiencing it as an adult.
So now that we've kind of gone over some of the unhealthy or the unpleasant impacts of COVID-19 pandemic, we're going to talk a little bit about some of the healthier impacts. There were stats and research has shown some of that as well. And, we might already be mindful of some of these statistics and some of these aspects and impacts, but go over them as well. First one, and really the big one that we see, is that the pandemic forced us to stay home with our family members, whether we liked it or not. But really, we were able to have more of that family time. We were, as we're in the research here, we were all given the gift of time. Parents worked from home, kids did school from home, parents went on fewer trips with their kids, but now we are able to share maybe more like dinner time together. 78% of parents said that they have been showing their children maybe more affection versus before. 87% of parents said they were spending more quality time with their kids. And, you know, that definitely takes into consideration the fact that people were forced to stay home at that time and learn to live, you know, maybe a healthier lifestyle with their family in a very different way than they have before. And which gets us to the next portion here is that we were able to create some new family traditions during the pandemic. With more time spent together at home, new traditions were created. These new traditions helped us thrive during the pandemic, as small events can add a lot of family time. For example, you know, family movie nights, game nights, board game nights, pizza nights, cooking nights. You know, we were all, you know, living in that gift of time where we had all this time to create new traditions with our family. We all developed a practical understanding of hygiene, and I think perhaps most of us, not just in our family, but as well in the workplace, we all have a better understanding of this hygiene, you know, more discussions about hygiene and germs more than ever. Knowledge is vital for the pandemic, but will be important for keeping kids and the people around us healthy. And numerous studies have shown as well that a variety of observations ranging from significant increases in hand hygiene to short-term improvements in water, sensation, and hygiene facilities. Hand hygiene performance has improved by 60% after the beginning of the pandemic.
Talk a little bit about some of the challenges that youth are experiencing. You know, we always like to come from that strength-based perspective as well, so including some of the positive things that maybe did come out of the pandemic as well. And now it poses the question, you know, how can we support the youth in our communities? What can we do to kind of be a part of that change and best support them? And, you know, one of the best things that we always recommend is if you notice sudden changes, sleeping, eating habits, just things that might be a little bit different. You know, if your youth is withdrawing from family, withdrawing from friends, ask them what's going on, chat with them a little bit about, you know, how you can best support them, and then hopefully book them in with, you know, some counseling supports or some supports within your community. And we're going to do a really good overview of how the Youth Wellness Hub can be one of those supports. But just chatting, having a conversation, really listening to what's going on, what they have to say, and, you know, normalizing that it's okay to have different feelings too, right? You know, we might not feel happy all the time, and that's okay. We're going to feel sad and angry and frustrated, and normalizing all those feelings and giving them kind of that platform to talk about some of those feelings. Sometimes electronic, social media, we know that can be a challenge as well in terms of how we feel. So maybe putting some of those away when we are having these conversations, or, you know, having maybe limits to that before bed if we're having trouble sleeping, because we know that that can kind of impact how we're able to sleep and get that really good rest at night. And finding balance, right? When we're talking about our mental health and we're talking about having good habits with mental health, we want to find that good balance between enjoying our time, having routine, things to look forward to in our schedule, right? Well, we're also getting things that we need to get done. So just really discussing with our youth about how we can support them with that balance, right? You know, if we're really stressed about school, if it's all school, how can we incorporate other things in there so that we are also having joy and looking forward to things in our week? And then, you know, get help if you need it. Leads us right into talking about what youth wellness hubs can support youth with, and where we're located. So what is a Youth Wellness Hub? So Youth Wellness Hubs Ontario, it's an initiative that started. It aims to bring right services to youth and their families at the right time in the right place. So our goal is to be low barrier services. All of our services are drop-in based and free. And each hub throughout Ontario right now, there are 14, and we're only growing, offers a variety of different services, but most of them will include counseling, peer support, group access, nursing access. We really want to be that one-stop shop for youth to access services exactly when they need them. So we're trying to avoid the waitlist piece, right? We have no waitlist. If you come in to see us at a Youth Wellness Hub, you're going to be able to see exactly who you need to see in that moment. Because oftentimes, you know, if a youth is experiencing a challenge, they're going to want to talk about it right in that moment. They don't always want to wait 3 or 4 weeks to get an appointment. So that's where we can be a great support for youth to access supports immediately. So again, just shows all the different services that we can offer. So substance use, mental health services, education, employment, community social supports, primary care. Specifically speaking through our Windsor lens, we opened March 21st, 2022. So we're still in our inaugural year of being opened, but we've had great growth. We've seen a lot of youth come use our services. And again, it's all drop-in based, no appointment needed when you need the services. So really having that, client-centered approach to accessing supports and services within your community. Some more notes about Youth Wellness Hub. So we're providing that rapid access to easily identifiable mental health and substance use services. So again, we're walk-in, low barrier services, clear pathways. We provide evidence-based interventions to match individuals' level of need and support transition specialized care services, integrate mental health, substance use, primary care, kind of all of those supports and services just in one space, right? So maybe a youth is coming to see us because they want some counseling. In that same day, they might be able to see a nurse as well. So just kind of having that access to a lot of different services in one space. Want to make things nice and easy so that you feel comfortable and safe to kind of continue to access supports and services as well. So yeah, reducing transitions between services through co-location shared services in a single place. Establishing common evaluation across sites. So again, right now there's 14 youth wellness hubs across Ontario. Lots of different locations, and if you're interested in where they're located, everything can be found youthwellnesshubs.com. So if you do have youth in mind that could benefit from this support, it would be a great space to kind of send them to get more information and to kind of have that first step in accessing supports. Another great component with Youth Wellness Hubs is it's truly for the youth by the youth. So we have youth advisory councils. We meet with them every other week. They make a lot of decisions about what goes on in the hub, what challenges they find that youth are seeing, and we really try and tailor everything that we're doing to what the Youth Advisory Council is suggesting to us, which is a really important component as well, right? You need to have a voice in the services that we're delivering. This is just a little information about where we are located. Youth Wellness Hubs are across Ontario in lots of different spaces. We're actually getting ready to move into our new permanent space, which is very exciting. But right now, this is where we're located, just kind of like what the space looks like. And just to give you a little bit of an idea of our hours, we are open youth-friendly hours, right? We recognize that youth want to access services at school. So we are open later into the evening. And we like to offer lots of different groups in the evening as well. I was saying earlier, tomorrow night, every month we have therapy dogs that come in. Just a great opportunity for youth to connect with maybe a different type of wellness service as well, right? If youth aren't ready to access counseling, maybe they're ready to access something a little bit different to support their overall well-being and wellness. And these groups also give youth an opportunity to talk with other youth. We've seen a lot of social anxiety come out of the pandemic, a lot of fear of, talking to new people, making new friends. And this platform of having a Youth Wellness Hub gives youth that opportunity to make new friends in that safe space. Again, right now our services are aged 12 to 25, and that would be the age range across Ontario for youth to access Youth Wellness Hubs. Everything is walk-in based, so you never need an appointment to come in, which makes things very easy for youth to access. So if you're having a conversation with your youth and they feel ready to access services, you can just bring them that day, which makes the transition very easy. And again, just mental health challenges and substance use challenges, that primary care piece, which is nursing, peer support, educational groups, recreational activities. So lots of opportunities to, encourage overall well-being and also encourage youth to make new friends and make new relationships and things like that.
I'm just going to briefly go over all of those different resources that we offer here at the Youth Wellness Hub, beginning with mental health counseling. So Ashleigh and I are actually the two here at the Youth Wellness Hub or the mental health workers, as our title states, and we both are trained in a variety of modalities, including CBT, cognitive behavioral therapy, dialectical behavioral therapy, narrative therapy, motivational therapy, and single session therapy. And basically the youth comes in and is able to talk about anything they want. No topics are off limits. And although it is a single session model, that youth, if they are comfortable with either of us, they're able to come in, once a week or once every 2 weeks. But they are able to come in at the time that they are able to come in, right? So it's not that specific booked appointment. But they're able to call in ahead of time to make sure that we're here if they're looking to see either of us, which is pretty cool, I would say. And that's not offered in a lot of places. So again, it's one-on-one talk therapy that is specific here as well. We also offer addiction counseling. So a few times a week, we do have some addiction counselors specific that do come in. Evidence-based psychotherapy tailored to the needs of each client. So it can start with substance use behaviors and end with, gambling addiction or sex addiction or pornography, whatever it is, really, it could be tailored to that specific issue, as well as, other referrals that need to be made throughout the city if needed for more than a single session model. And I know that Ashleigh already talked about this a little bit, but we also have the primary care services. So we do have a nurse practitioner that's here a few times a week as well, and they're able to assist the youth with sexual health, physical health, and other mental health needs. They're able to make referrals throughout the city. I believe they're able to prescribe medication as well if needed. So again, tailored to that specific youth. And it's really, just down the hall. So if I personally, for example, they're in session for a counseling session and I notice that this youth might need some extra help from a medical professional, they just go down the hall and they're able to receive that service. And then we also have something pretty unique called peer support. So peer support offers a strength-based, non-clinical recovery approach to help youth with their recovery journey. So each peer support worker that we have here is able to offer support based on their own lived experience with mental health. They're able to provide relatability to experiences that others cannot, for example. So that one-on-one approach has been extremely helpful to youth, and oftentimes youth do prefer that approach versus a clinical approach when they're maybe just looking to vent, or they're just looking to have somebody to relate to based on the experiences that they've been struggling with. Oops. And then a big part of our program as well is our educational and recreation groups and recreational activities. So we offer a ton of groups weekly. And every month we do have some of those main groups, but every month we also add some newer groups depending on the weather, depending on the season. So we have our cooking group, we have our art group, we have our therapy dog group, we have natural pathways, which come in a few times a month to help make art using things from nature. We also have, educational groups and folks who come in to help job search. We have homework help. And then we also have some of those treatment or support groups. We have Kick That Habit group, which is specific for beating an addiction. We also have, self-esteem groups. We have specific to anxiety and depression groups. So, every day there are different groups that are, again, being tailored to a specific issue as well, depending on, what the client is looking for. And we also have groups tailored to different ages as well. So for example, we have a self-esteem group for over 16, and then we have one for 12 to 14, just so we're able to focus on developmental levels and all that. So Again, a lot of work is being put into some of those groups and those activities to be tailored specifically to those youth.
So this just gives like a bit of an overview of some of the stuff that we have available. And specifically, we're speaking from like our Windsor lens, but we really felt like this is a great resource to share today with folks because it is across Ontario, and it is going to be kind of that same approach at a lot of different hubs. Again, easy access, low barrier. That is something that all of the hubs, that's part of the model. So very thankful for a lot of our community partners as well, which is the same model as well for other hubs across Ontario. They're going to be partnering with different agencies, different people in the community to provide supports out of their hub. So again, just really emphasizing that one-stop shop model. So if you are working with a family or working with a youth and you're not sure where to start, which is oftentimes the story that we hear, the Youth Wellness Hub can be a great place to get started because we can get folks connected with a lot of different resources. So we really appreciate everybody's time. Here, I'm just going to stop sharing the screen here. There we go. Just pop back on here. There we go. We appreciate everybody's time today. We're happy to take any questions about youth mental health or our Youth Wellness Hub and what our model looks like, and happy to share any knowledge that we have.
Awesome. Thanks, Ashleigh and Zahra. There's a question here wondering about language and cultural accessibility for the Youth Hub services.
Definitely. So Zahra is our trilingual counselor. So she speaks Arabic and French as well as English. And we do have translation services available as well.
And the second to that question, I'm sorry, go ahead, Zahra.
I was just going to say our intake worker who, gets all the calls and all the emails is also bilingual. So she speaks.
I think it froze on their end. I don't know unless it's my end. Zahra, are you still there? Sorry, ladies, it keeps on freezing.
Oh yeah, that's okay.
Oh,
Yep.
no worries.
Okay, sorry, it was is it okay? it was going in and out.
Do you want us
Are
to
we
hop
good
back?
now?
Oh, there we go. Or we can
we
stop
good?
the video, whatever works.
I'm not sure. Maybe stop the video. There's just like one other question. It was, and I wasn't sure if it was on my end. I stopped my video too.
No worries. That's okay.
So the second part to that question was, and also about any experience you have run into in the intersection of your young clients and their work, perhaps examples of related stressors and or benefits or supports.
In terms of like youth in the workplace specifically, I mean, youth definitely come to counseling and access our counseling services to talk about potential like stressors at work. A big part of the Youth Wellness Hub's role is to help support youth finding jobs as well. You know, we're seeing like a lot of youth that want to get into the workforce, and just like the challenges associated with that, challenges in not having, right experience to kind of get their foot in the door in a space. So we want to help them with that piece. But I think just general work stress.
Yeah. We also, we do have usually like once a month someone from employment services come in to help out with that as well. So we try our best to assist because we know that that's an ongoing issue for youth.
Great. And I don't see any other questions. We'd like to sincerely thank you, Zahra and Ashleigh. That's great. It's it's awesome that it's expanding so much over the province. 14, and you're just in year 1 here. So clearly the services are needed. You answered one of my biggest questions as far as being referred and wait list, and I think that's a huge draw to the services you offer because so many people are hung up on not being able to get the support they need. So I think it's great what you guys are doing.
Thank you so much for having us, and
we appreciate the opportunity to share about our services.
Absolutely.
Awesome. Okay, so going on to our second